What if I told you that right there in your own kitchen, there's a poison you probably consume every day, thinking it's harmless? Something that drop by drop, day after day, is silently damaging two of the hardest working organs in your body. And what makes this so deeply unsettling is not that it's dangerous looking. It's not. It looks completely ordinary. It sits on your counter, in your pantry, in your refrigerator. You used it this morning. You will probably use it again tonight. And not once, not a single time, did it cross your mind that it was doing anything to you at all. I want to tell you about a patient of mine. She was 67 years old, active for her age, cooked most of her meals at home, took her medication faithfully, walked every morning without fail. By every measure she knew, she was doing everything right. When her results came back, her kidneys were functioning at less than 40% of normal capacity. And she had absolutely no idea, not a whisper of a warning. Because this is what kidney damage does. It hides. It waits. It lets years pass in silence. And by the time you feel it, the damage is already deep. I'm Dr. Sarah Ellison, and I've spent over a decade as a practicing nephrologist, a kidney specialist, helping patients understand, protect, and in many cases rescue their kidney health before permanent damage sets in. My mission has never been simply to treat kidney disease. Honestly, that part of my work is the hardest because by the time a patient is sitting across from me facing dialysis or a transplant, the window for easy intervention has already closed. I've sat with too many wonderful, vibrant people thinking about how differently things might have gone if someone had spoken plainly to them earlier. That is exactly why I'm here today. No complex medical language, no jargon, just clear, honest information, the kind I wish more doctors gave their patients before the damage was done. Today, I'm going to unmask the 4 hidden kidney killers hiding in plain sight in your everyday life, ranked from serious to absolutely devastating. And by the time we're done, you'll know exactly what to watch for and what to do about it. Before we get into what's hurting your kidneys, I want to take a moment to talk about what your kidneys actually do, because most people have genuinely no idea how extraordinary these 2 organs are. Your kidneys are roughly the size of your fist. You have 2 of them sitting quietly in your lower back. And right now, at this very moment, they are filtering approximately 200 liters of blood every single day. That is not a typo. 200 liters pulling out waste, toxins, and excess fluid, and sending clean blood back into circulation around the clock without rest. But they don't stop there. Your kidneys regulate your blood pressure. They produce the hormones that signal your bones to stay strong. They help your body make red blood cells so you don't become anemic. They manage the delicate balance of minerals, sodium, potassium, calcium, that your heart, muscles, and nerves depend on every second. In other words, your kidneys are not just filters. They're the command center for some of the most vital functions in your entire body. And here is the cruelest part of all of this. Your kidneys will not tell you when they are in trouble. They are, without question, the most silent organs in the human body. Unlike your heart, which races or skips to get your attention, your kidneys simply absorb the damage. They compensate. They adapt. They keep working even as their capacity quietly shrinks. Think of it like a dam developing an invisible crack. On the surface, everything looks fine. The water is still being held back. But underneath, the structure is weakening until the crack becomes too deep, and what took years to build collapses all at once. By the time most patients feel the symptoms, the persistent fatigue, the swollen ankles, the mental fog, their kidney function has often already dropped 40, sometimes 50% below normal. And those symptoms are so easy to blame on simply getting older. That is the trap. And that is why so many people arrive at my office asking the question I hear more than any other. "Doctor, how did I not know?" The answer is always the same. No one warned them clearly enough about the specific, everyday things quietly working against their kidneys for years. That ends today. Now, everything I just said applies to everyone. But if you are over 50, over 60, or beyond, you need to understand something that changes the stakes considerably. The rules change as we age. And when it comes to kidney health, age is a factor that changes everything. Just as our eyesight gradually softens and our joints begin to feel the years, our kidneys age too. After 40, the kidney's filtering capacity begins a slow, natural decline with every passing decade. Think of it like the engine of a car with high mileage. It still runs. It still gets you where you need to go. But it no longer has the resilience it had when it was new. It needs better fuel. It needs more careful maintenance. And it absolutely cannot handle the same abuse it once absorbed without consequence. Now add to that the two conditions most common in adults over 60, high blood pressure and type 2 diabetes. These are not just common health problems. They are, medically speaking, the number 1 and number 2 causes of kidney failure in the entire world. They are like two hammers striking the delicate filtering structure of your kidneys, day after day, without pause. And here is what makes this a genuine crisis. Most of the things that drive both of these conditions are things we consume every single day without a second thought. Things hiding in your pantry, your fridge, your medicine cabinet. Things I'm about to show you right now. Pay close attention, because number 1 is going to surprise you. Killer number 4, sedentary behavior. Killer number 4 might catch you off guard because it isn't something you eat or drink. It's something you don't do. I'm talking about prolonged sitting, spending hours at a time without moving on the couch, in a chair, in bed. And before you think this can't possibly be as serious as what you eat, I want you to hear me out. Because the science on this is clear, and the connection to kidney damage is more direct than most people ever realize. Your kidneys are completely dependent on healthy blood flow to do their job. Every second of every day, blood needs to arrive at those filters with enough force and volume to push through and clean what your body sends their way. That circulation is everything. Now picture a river. When water flows freely, it stays clear, it moves with energy, and it carries everything cleanly along with it. But when that same water stops moving, when it sits still and stagnates, it becomes murky. Things settle. The water turns toxic. That is your circulatory system when you sit for hours without moving. When you stop moving, your muscles stop pulling glucose out of the bloodstream, and blood sugar starts to climb. Your body produces insulin to manage it, but over time the cells stop responding properly. That is the beginning of insulin resistance and eventually type 2 diabetes. At the same time, inactivity promotes weight gain, which drives blood pressure higher. And we've already talked about what high blood pressure does to your kidneys. The solution does not require you to become an athlete overnight. It requires something much more manageable, consistent, gentle, daily movement. Start by simply breaking up long periods of sitting. Set a reminder on your phone every hour. When it goes off, stand up. Walk to the kitchen. Walk to the window. Stretch your arms. That 2-minute interruption of stillness is enough to get blood moving again. From there, build toward a daily walk. Even 10 minutes, done consistently, produces measurable improvements in blood pressure, blood sugar, and kidney function. If mobility is a challenge, chair-based movement still counts. Lifting your legs, rotating your ankles, stretching your arms, any movement is better than none. Every step is a wave of healthy circulation reaching your kidneys. Now killer number 3 hides somewhere just as familiar and just as trusted as your kitchen, your medicine cabinet. I'm talking about non-steroidal anti-inflammatory drugs, NSAIDs. You know them as ibuprofen, naproxen, and diclofenac. They're sold over the counter. They work quickly. And because no prescription is required, most people assume they must be safe to take regularly. That assumption is one of the most dangerous in medicine. Here is what happens inside your body when you take an NSAID. To maintain strong, steady blood flow to your kidneys, your body produces compounds called prostaglandins. Think of prostaglandins as the gatekeepers. They keep the tiny arteries feeding your kidneys open and relaxed, ensuring a constant, healthy supply of blood reaches those filters at all times. NSAIDs work by blocking prostaglandins throughout your body to reduce pain and inflammation. And they do that very effectively. The problem is they do not discriminate. They block the prostaglandins, protecting your kidneys right along with the ones causing your headache or your joint pain. When those protective compounds disappear, the arteries feeding your kidneys begin to constrict. Blood flow drops. Oxygen to your kidney tissue decreases sharply. Imagine a garden hose delivering water to a plant. Now imagine someone steps on that hose, not completely, just partially, for a few hours every single day. The plant doesn't die immediately, but over days, over weeks, over months of that restricted flow, it quietly withers. The roots dry out. And one day, the damage simply cannot be undone. That is exactly what chronic NSAID use does to your kidneys. And the danger is especially significant for older adults because our kidneys already operate with reduced filtering capacity and because chronic pain conditions like arthritis and joint deterioration make reaching for that pill an almost daily habit. I am not here to tell you to ignore your pain. Quality of life matters deeply. But the solution to chronic pain is not a daily NSAID. It is finding the source and addressing it properly. Talk to your doctor. Acetaminophen is generally much gentler on the kidneys when taken in the right doses. Physical therapy, heat, cold, and gentle stretching can provide real relief for many types of chronic pain without the kidney risk. And be honest with every healthcare provider you see about everything you take, including vitamins, supplements, and over-the-counter remedies, because many cold medications and sleep aids contain hidden NSAIDs. The rule is simple. Using NSAIDs occasionally for short-term pain is generally fine. Depending on them daily without medical supervision is, over time, a direct threat to the organs working hardest to keep you healthy. Number 2 on our list is something I hear patients dismiss almost every single time I bring it up. And I understand why, because the way most of us think about salt is fundamentally wrong. But Dr. Ellison, I barely touch the salt shaker. I hear that constantly. And every time, I have to explain what research has confirmed for decades. The salt shaker on your table is not the problem. The problem is the invisible flood of sodium hiding inside almost every packaged food you eat. More than 75% of the sodium in the average adult's diet comes not from anything they consciously add, but from processed and packaged foods. Bread, deli meats, canned soups, breakfast cereals, bottled sauces, frozen dinners, cheese, foods that don't taste remotely salty. The food industry adds sodium to extend shelf life, enhance flavor, and preserve texture, and it has become so widespread that avoiding it requires active, intentional effort. So why does this matter so deeply for your kidneys? When you consume too much sodium, your body retains water to dilute the excess. Blood volume in your arteries rises. And as that volume rises, the pressure inside your blood vessels rises with it. That is high blood pressure in its most fundamental form. And high blood pressure is the second leading cause of kidney failure in the world. Here is why that statistic is so serious when you understand it at the level of your kidneys. The filters inside are built from an extraordinarily delicate network of tiny blood vessels. They are not designed to withstand sustained, forceful pressure. Imagine blasting fine silk with a fire hose at full force, day after day. That pressure would shred it. That is exactly what chronic high blood pressure does to the microscopic filtering structures inside your kidneys, slowly, silently, and permanently. The good news is that protecting yourself from this one is genuinely within your control. Become what I call a label detective. Flip the package over before it goes in your cart and look for one word, sodium. What you find will likely shock you. Breakfast cereals, packaged breads, flavored crackers, many contain more sodium per serving than you would ever imagine. Cook at home when you can, not because it has to be complicated, but because when you prepare your own food, you control exactly what goes into it. And when you do cook, Discover what flavor looks like without sodium. Garlic, fresh lemon, rosemary, cumin, turmeric, paprika, vinegar. These are not substitutes for flavor. They are flavor in its purest form. One extra tip: if you use canned vegetables, rinse them under cold water before cooking. That single step removes a surprising portion of the added sodium. Within a few weeks of reducing sodium, something remarkable happens. Your taste buds recalibrate. Foods that once tasted normal begin to taste overwhelmingly salty. You begin to taste the actual ingredients in what you eat. And the effect on your blood pressure, often within weeks, becomes measurable. And now we arrive at number 1. We have talked about inactivity, about painkillers, about hidden salt. All of them are serious. All of them cause real damage. But none of them compare to what I am about to tell you, in terms of how widespread it is, how deeply embedded it is in our food supply, how addictive it is by design, and how many simultaneous ways it attacks your kidneys at once. Killer number 1 is sugar, and its nearly identical partner, refined flour. I know, you have heard about sugar before. It causes weight gain. It's bad for your teeth. You should eat less of it. But I don't think most people truly understand what sugar does to the kidneys specifically. And until you do, it is almost impossible to feel the urgency this deserves. Because this is not one attack. It is 4 launched simultaneously, from different directions, all converging on the same organs. The first front, the direct highway to diabetes and dialysis. Diabetes is the single leading cause of kidney failure in the world. And the primary driver of type 2 diabetes is the chronic, excessive consumption of sugar and refined carbohydrates. White bread, white pasta, pastries, crackers, refined flour is broken down almost instantly into glucose and dumped into your bloodstream in a rapid, overwhelming wave. Your pancreas releases insulin to manage it. This cycle repeats every day, every meal, for years. Eventually, the cells stop responding. Insulin resistance sets in. Blood sugar stays chronically high. Type 2 diabetes develops. And once it does, the destruction of kidney tissue begins in earnest. Excess blood sugar attaches to the proteins making up your kidney filters and effectively caramelizes them, making them stiff, thick, and unable to function. This is called diabetic nephropathy, and it is the fastest, most direct road from poor dietary habits to dialysis that medicine knows of. The second front, blood pressure. For years, salt was considered the primary dietary driver of high blood pressure. But research over the last 2 decades has revealed something that changes the picture entirely. Sugar may be just as damaging to blood pressure as sodium, possibly more so. A high-sugar diet triggers hormonal responses that constrict blood vessels and cause the kidneys to retain more fluid, the exact same mechanism by which excess sodium raises blood pressure. So even if you've been careful about salt, if sugar is high, your kidney filters are still being subjected to that same relentless, damaging pressure. The third front, chronic inflammation. Sugar is one of the most powerful triggers of inflammation in the human body. Not the acute kind you feel when you sprain an ankle. That kind is protective and temporary. I'm talking about low-grade, chronic inflammation that simmers continuously, below the threshold of feeling, but deeply destructive to the tissues it reaches. It attacks the inner lining of blood vessels throughout your body, including the extraordinarily delicate vessels inside your kidneys. Over time, it scars them, stiffens them, accelerates exactly the kind of structural damage that leads to chronic kidney disease. The fourth front, obesity and fatty liver. When the sugar you consume exceeds what your body can burn for energy, your liver converts the excess into fat. Over time, this fat accumulates, first in the liver, producing fatty liver disease, which disrupts the metabolic processes your kidneys depend on. Then it spreads outward, contributing to obesity. And obesity is an independent risk factor for kidney disease, above and beyond its connection to diabetes and blood pressure. It forces the heart to work harder, elevates pressure throughout the cardiovascular system, and alters the hormonal environment in ways that directly accelerate kidney deterioration. For fronts, one dietary pattern. And yet it is the most heavily marketed, most addictively formulated, most deeply embedded category of food in modern life. So here is your path forward. The most impactful change you can make is eliminating liquid sugar first. Sodas, sweetened juices, flavored teas, sweetened coffees. A single can of soda contains 8 to 10 teaspoons of sugar, absorbed faster than almost any other form. Replace them with water, sparkling water with lemon or unsweetened herbal teas. This single change, done consistently, can produce remarkable improvements in blood sugar and blood pressure within weeks. Second, learn sugar's aliases. On ingredient labels, sugar hides under dozens of names. High fructose corn syrup, dextrose, maltose, sucrose, cane juice, agave nectar. These are all the same thing in disguise. Third, be deeply suspicious of anything labeled low-fat. When fat is removed from a product, flavor and texture go with it. To compensate, manufacturers replace it with sugar. Low-fat flavored yogurt, low-fat salad dressings, low-fat cereals. Check the label. In many cases, the so-called healthier option is loaded with more sugar than the original. And finally, build your meals around real, whole foods. Vegetables, fruits, lean proteins, eggs, nuts, legumes. When your plate is built on these foundations, sugar and refined flour naturally disappear, not through deprivation, but because you simply no longer need them. Every day you reduce sugar, you are reducing inflammation in your blood vessels, lowering pressure in your kidney filters, and giving your body a genuine fighting chance. We have covered a lot of ground today, and if something in today's video opened your eyes, if there is something you didn't know before, something that made you look at your kitchen or your medicine cabinet differently, please do something for me. Share this video. Send it to someone you love. A parent, an adult child, a sibling, a close friend. The information you now have could be the thing that prompts someone in your life to make a change before the damage is done. That is not a small thing. That is one of the most meaningful things you could do this week. If you are not yet subscribed to this channel, I would love for you to join us. Every day I bring you clear, honest, practical health information, especially for adults over 50 who deserve straightforward answers without the noise. Hit that subscribe button and turn on notifications so you never miss one. I'm Dr. Sarah Ellison, and I'll see you in the next one.